group for inferior vena cava. This is the group for inferior vena cava. So put this finger vertically to this, and this right side or right part of the superior surface is slightly above than the left part. Inferior border is directed inferiorly, and this convex surface or superior surface is directed above, and falciform ligament is directed anteriorly. This is the anatomical position. Here, group for inferior vena cava put vertically. Right side of the superior surface is slightly above than the left side, and falciform ligament faces anteriorly, and convex surface is directed above. Clear? Now this is the anterior surface, which is divided by falciform ligament into right and left anatomical lobe. Here, this is the falciform ligament which connects the liver and diaphragm with the anterior abdominal wall up to the umbilicus. And this is the right lateral surface. This is the right lateral surface. This is the impression of the ribs. This is the right lateral surface. And this is the superior surface. Middle part depressed and both sides convex. Middle part is related with the pericardium with heart, and both sides with pleura and lungs above the diaphragm. And now this is anterior surface, superior surface, right lateral surface, and this is the inferior border which starts from the, this is the group for inferior vena cava. So this is the BR area, this triangular area, this is the BR area of the liver. This is the base and this is the apex. This is the base, this is the apex. This is the BR area, this is the base, and this is the apex. Falciform ligament, this is the falciform ligament. Falciform ligament above split into two layers and forms the superior layer of the coronary ligament, and to the left it forms the left triangular ligament which connects the liver with the diaphragm, and at the apex the junction of superior layer of coronary ligament and inferior layer of coronary ligament, which forms the right triangular ligament, and right triangular ligament connects the liver with the diaphragm. And this is the starting point of all three borders. So most prominent border is the inferior border. Start from this. This is the inferior border. This is the inferior border. Right triangular to left triangular. Here, and inferior border also presents two notch. This is one notch. This is one notch. One notch for the gallbladder and one notch from the ligamentum series hepatis. So this is the inferior border, and this is the posterior inferior border. Starts from this ligament, this apex, which passes along the lower margin of the BR area and lower margin of the inferior vena cava and lower margin of the caudate lobe, and this border above the two process. See this is the caudate process. This is the caudate process, and this is the papillary process. Papillary process, caudate process. And this is the fissure for ligamentum venosum present anterior wall, posterior wall. This is the anterior wall, posterior wall. This is the fissure. This is the floor of the fissure. This is the anterior wall, this is the posterior wall. And posterior wall forms the part of the caudate loop. Clear?
ফ্লোরটা কোন পার্টটাকে দেখাবে?
এই যে এইটা ফ্লোর।
আচ্ছা, এটা অ্যান্টেরিয়র পোস্টেরিয়র?
ফ্লোর মানে কি?
আমাদের বেস
ছবি এঁকে দেখিয়ে দিয়েছি তো। এই যে এটা ফ্লোর, এইটা একটা ওয়াল, এইটা একটা ওয়াল। So posterior inferior border. This is the posterior inferior border which passes above the papillary and caudate process. So papillary process and caudate process is a part of inferior surface, not the posterior. Clear? Now the posterior superior border start from this up to this. Clear? Posterior superior border separate the superior surface from the posterior surface, and posterior inferior border separate the posterior surface from the inferior surface. This is the bare area of the liver. This is the group for inferior vena cava. This is the caudate lobe. This is the ligamentum, fissure for ligamentum venosum, and this is the related with the abdominal part of the esophagus. So these are the features of posterior surface. Clear? Now the inferior surface. This is the gastric impression related with anterosuperior surface of the stomach. And this is the fissure for ligamentum diaphragm. This. And this is the quadrate lobe. Quadrate lobe between the gallbladder, fossa for gallbladder, and ligamentum diaphragm. And this is the fossa for gallbladder. And this is the gallbladder. This is the fundus, body, and neck. So this is the duodenal part. Duodenal impression. This is the colic impression. This is the renal impression. Gastric impression. Fissure for ligamentum diaphragm. Quadrate lobe. Fossa for gallbladder, duodenal impression, colic impression, renal impression. Clear? Now, for দেখতে পেয়েছো? Again, anatomical position, hold vertically by putting the thumb, right thumb, within the groove for inferior vena cava, and right part of the superior surface is above than the left part, and this surface faces upwards. Anterior surface which falciform ligament faces anteriorly, and inferior border faces inferior, sharp inferior border. পেয়েছো দেখতে সবাই?